You hear a sudden gunshot nearby. Screams erupt, people scatter, and instinct takes over as your heart pounds and your body reacts before understanding anything. You dive for cover, breathing hard, confused, then glance down and notice blood spreading even though pain strangely hasn't arrived yet. This moment raises a haunting question. What does being shot actually feel like beyond what movies and television dramatize on screen? Survivors often describe shock and numbness first, because the brain prioritizes survival over pain when faced with sudden, life-threatening danger. In these seconds, the brain floods the bloodstream with adrenaline, activating emergency systems designed to keep the body functioning at all costs. Adrenaline raises heart rate, blood pressure, and airflow, allowing movement, focus, and strength even when severe internal injuries have already occurred. Because pain signals are briefly suppressed, some victims continue running or seeking help without realizing they've been seriously wounded. The eventual sensation depends on factors like bullet size, speed, fragmentation, and where the body was struck during impact. As shock fades, many survivors report an intense burning sensation, spreading outward from the wound as nerves begin reacting violently. This marks the transition from numbness to pain, when the brain fully recognizes injury and initiates inflammation and damage control responses. Many survivors recall feeling pressure or impact, like a shove or pebble strike, rather than pain, as the bullet first penetrates skin. This numbness distorts awareness, making moments feel slowed or unreal, as the brain narrows focus solely on survival rather than pain interpretation. Once awareness returns, confusion gives way to realization, as the mind begins processing injury severity and the threat shifts from escape to survival. Victims frequently compare this burning to severe stings or extreme heat, concentrated at the wound before radiating outward through surrounding nerves and tissue. Bullet construction matters greatly, as rounds that fragment inside the body tear tissue extensively, amplifying inflammation, bleeding, and pain across affected areas widely. By contrast, smaller rounds that pass cleanly may cause delayed pain, despite causing dangerous internal injuries depending on trajectory, speed, and location. As adrenaline fades, nerves regain sensitivity, sending urgent signals that transformed earlier numbness into sharp, escalating pain throughout damaged tissue and muscles. At this point, pain no longer comes in flashes but lingers continuously as damaged nerves keep sending distress signals without relief. How pain develops next depends largely on where the bullet traveled, determining which nerves, tissues, or organs absorb the damage first. As shock stabilizes, physical symptoms emerge rapidly, revealing how much damage the body has endured beneath adrenaline's temporary protection. Beyond pain, the body often shakes or trembles uncontrollably, a stress response caused by adrenaline surges and rapid nervous system activation. Blood loss begins immediately, and depending on the wound, victims may feel warmth spreading as blood escapes into clothing or surrounding tissue. Vision can narrow or blur, with some survivors reporting tunnel vision as the brain prioritizes survival over sensory detail. Hearing may distort as well, with loud ringing or muffled sounds replacing normal perception during acute shock. Confusion is common as oxygen delivery fluctuates and the brain struggles to process injury, danger, and movement simultaneously. Despite severe wounds, some individuals remain mobile, acting as if uninjured, unaware that critical damage is worsening beneath adrenaline's temporary illusion. This temporary strength is deceptive, as physical collapse can follow quickly once blood pressure drops or shock deepens. Pain perception varies widely, influenced by psychology, prior trauma, expectations, and individual neurological thresholds. Emotional realization often arrives only after safety, when shock fades and the brain finally processes the seriousness of the injury. At this stage, the body's focus shifts from escape to damage control, activating clotting, inflammation, and immune responses rapidly. As shock deepens, skin may turn pale or clammy, reflecting the body redirecting blood toward vital organs to preserve life. Muscles often weaken as oxygen delivery drops, making simple movements feel heavy, uncoordinated, or suddenly impossible. Pain intensifies as inflammation spreads and nerves regain signaling, amplifying damage awareness once adrenaline no longer suppresses sensory input. Many survivors describe this pain as spreading outward, radiating along nerves and surrounding tissue rather than remaining localized. The brain may misinterpret nerve damage signals, causing injured areas to feel unnaturally hot, even without actual temperature change. Others compare the pain to repeated blunt force, like being struck continuously at the same spot without relief. Numbness can coexist with pain, creating a confusing mix where parts of the body feel disconnected or unreal. This sensory confusion reflects nerve trauma, as damaged pathways send distorted or incomplete signals to the brain. Emotional reactions also surface, including fear, disbelief, or calm detachment, as the mind struggles to process sudden trauma. For many, the realization of being shot arrives late, only after pain, blood loss, and confusion fully set in. How a gunshot feels depends heavily on where the bullet enters, as different areas contain varying nerves, tissues, and vital structures. Wounds to limbs often feel different from those to the torso, since muscles tolerate damage differently than organs or dense nerve clusters. A bullet passing through soft tissue may cause intense pain, but damage to organs can trigger shock before pain fully registers. Bullet size influences how much kinetic energy is transferred into the body, with larger rounds delivering stronger shock waves that intensify tissue stress and nerve trauma. Smaller bullets that pass cleanly through tissue may initially hurt less, especially if they avoid bones and major nerves. However, internal damage can still be severe, even when entry wounds appear small or deceptively minor from the outside. Bone fractures caused by bullets dramatically increase pain, sending sharp signals through surrounding nerves and muscle tissue. Shrapnel from fragmented bullets can create multiple injury paths, amplifying pain and complicating the body's response. As bleeding continues, dizziness and weakness may grow, signaling dangerous blood loss rather than pain alone. At this stage, survival depends on rapid medical intervention, as the body cannot sustain prolonged trauma unaided. Some survivors report surprisingly little pain, feeling only pressure or impact, especially during the first moments after being shot. This pain-free window can last seconds or minutes, creating a dangerous delay before the brain fully recognizes how serious the injury actually is. Being shot in areas with fewer vital organs, such as the calf or outer limbs, can also reduce immediate pain perception. However, wounds to the head create entirely different sensations, combining neurological disruption with physical trauma. Some headshot survivors report intense headaches rather than sharp pain, unaware they were shot until examined medically. Ringing in the ears is common after head wounds, described as buzzing, bells, or overwhelming internal noise. This ringing can persist for hours, days, or longer, caused by shock waves affecting the auditory and nervous systems. Confusion and disorientation often follow as the brain struggles to process injury while maintaining basic functions. Loss of consciousness may occur when pain, blood loss, or neurological overload exceed the body's coping capacity. Even when survival is possible, head injuries often introduce long-term sensory and cognitive challenges. For many survivors, the most painful phase begins after the shooting, during surgery and medical treatment to repair internal damage. Recovery often involves multiple operations, long hospital stays, and persistent pain as tissues slowly heal over weeks or months. Physical pain may gradually fade, but limited mobility, nerve damage, or chronic discomfort can remain long after wounds close. Psychological trauma frequently lingers as the brain replays the moment of being shot through intrusive memories or sudden fear responses. Many survivors develop post-traumatic stress, becoming hyper-alert to loud noises, crowds, or situations resembling the original event. Therapy and counseling can help, but emotional recovery often takes far longer than physical healing. Some survivors report that surviving a gunshot permanently changes their perception of safety, mortality, and everyday life. Being shot is not defined by a single sensation, but by a sequence of shock, pain, recovery, and lasting psychological impact. How it feels depends on the body, the bullet, the injury location, and how quickly help arrives.
Ultimately, surviving a gunshot reveals how fragile the human body is and how powerfully it fights to stay alive.